Good morning, beautiful people, and welcome to another episode of Conquering Cancer and Beyond. Today, I have the honor of interviewing Lori Leadley. She has had an amazing story. Lori was diagnosed with a very aggressive and rare form of cancer called Burkitt's lymphoma while she was pregnant with her third son. Doctors told her that in order to live, she needed chemotherapy immediately, but the chances of losing or damaging her unborn child were extremely high. They advised her to consider aborting her child to save her own life. It was not an easy decision to make for her, but her and her husband decided against the abortion, went through 4 chemo treatments, 3 surgeries, and just a couple of months later, Lori gave birth to a healthy baby boy. In 2015, unfortunately, Lori was diagnosed again with cancer, this time stage 1 breast cancer, and underwent a double mastectomy and 15 more months of chemotherapy. By 2016, she was once again declared cancer-free. She's truly an amazing woman and a successful business owner. She's the president of Valley Sleep Center, where she helps others fall asleep and stay asleep because she knows firsthand that the lack of sleep impacts our body's ability to heal. Welcome, Lori, and thank you so much for joining me and sharing your cancer story. How are you doing today?
I'm doing great. Thanks, Priya, for having me.
Of course, Lori. I love how inspiring your story is. And I'd like to just start by asking you, at what age were you diagnosed and what went through your mind when you heard those words, you have cancer?
Well, my very first cancer of the breast was actually Burkitt's lymphoma in my left breast. I was just 26 years old, and I had a 4-year-old, a 2-year-old, and I was pregnant with my third child, about 22 weeks pregnant when they told me, you have cancer. We don't know what kind of cancer. It looks like it's a very aggressive cancer, and we don't know what we're going to do because you're pregnant. And it was obviously earth-shattering, very stressful. All I could think of was that I was going to die and leave my husband and 3 kids behind. I didn't even know if my son would survive. And I had a lot of appointments in a short amount of time. And even the national medical director of lymphoma at the time recommended that, I terminate my pregnancy. They couldn't do a termination in the state because I was past the second trimester. So it was really, really challenging, just trying to figure out what to do. I could have had him then, but he weighed a pound. And I found a physician, Dr. Cavalcant, who's retired, was part of Desert Oncology, which is now Ironwood. And he said, you need chemo tomorrow. I know you want to be here for that baby, but your baby could die. And so you need to really consider your treatment options, which at the time were terminate, have the baby when he weighed a pound, or take chemo while I was pregnant. And that weekend we went to church and I heard our pastor preach, you'll never have joy in your life without taking risks. And I knew at that moment that was our message, that we needed to take the risk of me taking chemo while I was pregnant. And so that very next Monday, I started chemotherapy while I was pregnant.
Wow.
With Connor. And I took 4 treatments while I was pregnant. I did CHOP back then, Cytoxin, Adriamycin, vincristine, and prednisone. I remember Dr. Cavalcant coming in my room and saying, I cannot compromise this treatment at all, but you need to understand that these drugs could kill your baby. And so I was all in, of course, scared. Everyone was scared, but I had the faith that my son would be delivered to me exactly how he should be. And he was. So on January 7th, 1993, which was my 27th birthday, my son Connor, who is now 27, was born with a full head of hair when I didn't have a hair on my body. And it was a miracle. Every hospital worker, all my family, friends, just a huge answer to prayers. And we were just so grateful that day for receiving a perfect child. So I finished chemo then back in 93, and they watched me really closely for 5 years because Burkitt's lymphoma is super aggressive. And once I made it through the 5 years, I felt like I'm invincible and I could do anything. And I did. I had a little business testing patients at home and, for overnight oximetry. I'm a respiratory therapist, and I wanted to learn sleep because there was a lot of things I was seeing in my patients about sleep. And so after we hit that 5-year mark, I began my journey to become a sleep technologist and a clinical sleep educator. And I launched Valley Sleep Center, a Valley Sleep Physicians and Valley Sleep Therapy, which are companies now that help patients daily to better sleep health overall. So fast forward to 2015, and I found a lump in the other breast.
Oh.
And so I had gone 23 years with nothing. And this time, my diagnosis was invasive ductal carcinoma. I actually was told I was ER positive, PR positive, HER2 negative in my original biopsy. Again, saw a lot of doctors in a short amount of time, but I had decided I really wanted a double mastectomy because I was just feeling like I've had 2 different cancers and 2 different breasts, like they're coming off. I don't want any opportunity for this to reoccur ever. And so they weren't recommending that because I was only stage 1. But I just said, I don't care, I'm doing this. And I actually ended up being a candidate for immediate reconstruction, which was really, really fortunate. And I went to sleep not knowing if I would wake up with just a sternum and a rib cage and have to have expanders. But I actually woke up with skin sparing, nipple sparing, and immediately reconstructed breasts, which was a miracle. I had received another miracle. Now, sadly, about 10 days after that double mastectomy, the pathology came back and I was HER2 positive, which means I need chemo right away. So more chemo. And the oncologist literally said to me, "You're no chemo virgin." And I was so mad. I was so mad because I'm like, who says that to somebody? But it was true. It was so true. And I actually ended up going, that was at MD Anderson, and I went to Ironwood because I met my most amazing oncologist, Sumit Mendanza, and she just said, "You need these drugs, and if you don't do well, we can back off. But we have to give you what the protocol is, and then if you don't do well, we'll back off." So I did the protocol, and we did have to back off because it was really, really hard. I was immediately dehydrated. Getting infections it was really, really a challenge. But I did get about 85%. I did finish all 6 treatments and a year of Herceptin, but I was in and out of the hospital multiple times. I still have low ejection fraction from all the adriamycin and the Herceptin that I've had, which is a challenge, but I really try to fight against it. Yesterday, I hiked up to the top of Wave Cave, which I swore I would never do again because when I did it in January, it was so difficult for me to do that incline with my heart. But my friends wanted to go, and I said, okay, we'll go. And I did really well, but it just is a constant reminder of your, heart pounding out of your chest when you try to exert yourself. My heart rate was 175 when I got to the top of that hill.
Wow.
And it's a hill. It's a mountain, but it's a mile and a half straight up. But anyway, I'm just happy to be here. I can't believe I've survived 2 cancers, and I'm 5 years post 2015. So 5 years ago today, I was in chemo, doing chemo. So
wow.
Almost Pat.
It's amazing what you've been through. And I think the lesson to learn from, what you've said thus far is that, when you have a reason to look forward to staying alive, I think it just gives you that faith, as you said. It gives you that energy, and it gives you it gives you what's the word I want to use, but it gives you that strength. Yes, it gives you the strength to just move on and say, you know what, I got this. I'll get through it, come what may. And I think for the first one, obviously, it was your son who you were carrying. So how did you manage the pregnancy? Because pregnancy alone has its own side effects, and on top of that,
yeah.
You had chemo that you were going through. I can't even imagine what you must have gone through.
It's been 28 years since I went through all that. And at the time, I have to be honest with you, being a cancer patient was the farthest thing from my mind. I was this pregnant lady trying to get her baby here alive, right?
Yeah.
I kind of skipped a lot of it, which is kind of bad because I had a lot of post-traumatic, stress stuff that I went through because I didn't deal with it when I should have, right? It's sort of, if you don't deal with it when it happens, it's going to hit you at some point.
Yeah.
I remember I went to a therapist and I was like, I just can't wait till this is over so I can just get back to my life. And she was like, you're not getting back to your life. You need to look at your new life and plan your new life. And I'm just like, oh, this is hilarious. Like, plan my new life. Like, I don't even know if I'm going to be here in 6 months. How do I plan? And I remember all my friends were setting goals. Like, this was like the thing to do, like a 5-year plan and what you're going to do in 1 year. And I'm like, I can't even plan like the next 6 months. How do I do this? And it was such a challenge, but it really taught me to live by faith and be in the present moment. Like every day we need to be present, but we also need to be looking for opportunities, right?
Absolutely.
And, cancer has prepared us, you and I, and everybody else who's had cancer for a pandemic. I mean, who would know what to do in a pandemic? But here we are, we're sort of experienced with stress, insomnia, not being able to sleep. What do we do in this situation? We've already been thrown into crisis. So we've already processed through that. So it's a little bit easier now having to deal, but I have been encouraging people, start planning what your new life is going to look like. Find opportunity in every day because there's opportunity in something for you every single day. You just have to look for it. Prayer, meditation, being still, finding the time to just be quiet and still so that you can give your brain the space to find those creative opportunities.
Absolutely. And I've always asked, all the cancer survivors who have interviewed before, of course, the pandemic that's going on, is that what's your new normal? Because obviously, when we're done with chemo treatments, the doctor's like, okay, we'll see you and your life should be back to normal, but it's never back to normal. We have to figure out what our new normal is. And I think, having gone through the cancer and knowing that, after the chemo treatment, our life is not going to be what it was before. And we have to figure out what our new normal is. So how did you figure that out, after your first and then second treatment? How did you figure out your new normal? And how did you have the courage to live and, look forward to the life that you have no control over?
Well, I'm a woman of faith, and I truly believe that each day I get here on earth is supposed to be for a reason. And I'm constantly looking for opportunities to create my new life, create my new opportunities, ask and listen, because you will hear a voice or get ideas and, truly it's out there, but you have to be able to create it. And look for it because it's not going to just happen. I remember sometimes I would just like sleep until I want to get out of bed because you could, that's like the worst thing to do. Like you need to go to bed at the same time and wake up at the same time. Even if you don't feel good, put your feet on the floor and have like little small goals. Like I remember I'm just going to walk to the end of the driveway and back. And then, a couple days, I do that every day. I even set a goal. I'm going to get out of my bed. I have the most beautiful view outside my bedroom window of Red Mountain, and I love laying there and being able to look at it. But I said, I'm not laying in this bed all day, every day. First of all, it's not good for you. No matter how sick you are, you should get up and move around. It's important for your lungs and your breath to, get that going. It's the worst opportunity for pneumonia ever to lay in a bed.
Yeah.
So I would just make sure every day I got out of my bed, and I had my husband bring a recliner and he put it in the other room. And so every day I had to get out of bed and go to the recliner. And then every day I had to walk to whatever my goal was set. And I knew some days were bad, some days were good. On the good days, I would go 6 driveways up. Now I can walk, 5 miles at a time, but you have to work your way up to that. And it's super important to move your body during all this.
Take it a day at a time. And
Mm-hmm.
do you feel that, every time there's some side effect or another that just keeps coming? And that's what I think a lot of us cancer patients are going through. Sometimes it's joint pain, sometimes it's
Right.
chemo brain, foggy brain,
Yeah.
and sometimes it's, just your arm hurts, and then you have the depression, and you have so many side effects that, in true essence, I think our journey begins after the treatments are over.
It's
Because
so
when you're
true.
going
Yeah.
through the treatment, you're just going through it, and the only thing on your mind is, what, I just need to get through this right now because I need to make sure I'm there for my kids, and I'm there, alive at the end of this. But
And new me. We're gonna have a new, even your kids, your husband, everybody needs to know we're gonna have a different way of doing things because this is what mom needs right now, right? We're having to do that right now in the middle of a pandemic. Everybody's at home, so we need to establish a daytime routine. Involve your kids in the days where, maybe give your kids like code words. Okay, mommy has great days, good days, and bad days. And then every morning you say, today is a good day. And if it's a day where your counts are down, you're just going to say, you know what, today's a bad day, but this is what we're going to do, right? And have a plan, execute a plan and show your kids, like, this is what we're going to do on mommy's good days, on mommy's great days, and on mommy's bad days. And reward them for having good attitudes through it too, because it's confusing. They don't understand, but if you communicate to them, then they're gonna know and understand. And we really, and write it down. Journal. I'm a big advocate of journaling. Write down your fears and your anxieties. Teach your kids to do this, but yet finish your journaling with 5 things you're thankful for, because gratitude is the antidote to anxiety and fear and all these things that we're succumbed with having cancer. And find peace in death, if that can make any sense. Like, I have peace knowing that I'm not going to be here someday. I only get so many days on this earth, and I'm going to make every single one count, and you can too. And basically you just plan that out and don't waste your energy. Oh, this is great. My oncologist gave me the best advice when my dad died of lung cancer 2 years ago. I was devastated and I was grieving, and I just didn't want to just go into depression. And we're always losing friends and sisters to this horrible disease. And it's so sad and it's so hard. But once you embrace death, that it's going to happen to me, and this is my plan to execute whatever days I have and make them count, you'll be a lot better off. But what Dr. Mendonça said to me that day on the phone was, why are you going to waste all your energy worrying about tomorrow when you can use that beautiful energy for something good today?
Absolutely.
And that was a pivotal statement that I heard that day. And I honestly have just done everything I can to make sure that I conserve my energy, find ways to create energy, and to use that energy to inspire others. I truly believe it's why I'm still here today.
I totally agree with that advice. And I just recently wrote an article on, everything that's happening. And I also had the opportunity to speak for the East Valley virtual event. I said one thing, that because, going through cancer, you have nowhere to go, and the only place to go is inside. And that's what people should be doing right now, is trying to figure out who you really are, and how do you want to go back once you're able to go back in the world. How do you want to present yourself? Because it's not going to be the same anymore. You're going to have to figure out a new way to go back, and what are you going to take back from this? And it's so true. Every day is a gift. And I think the biggest thing we all do is worry about a situation that has not occurred, and that's called fear. Because in our minds, we make up this situation to be even worse than it is. And in that process, we miss out on today and right now. And we need to be grateful, as you said, that we are with our loved ones. Even though we're at home, we're isolated, but we're with our family. And we're not going to get this time again. You just never
Which
know.
is a beautiful opportunity, right?
Absolutely
It's
is.
opportunity.
And the only thing guaranteed in life is death. You know, I don't like it when people say, oh, you only live once. No, we live every day. Every day when we wake up, we're living. We're only going to die
Mm-hmm.
once. So we got to just go and take it a day at a time, and, just cherish the moments that we have. So, Lauri, I would just like to ask you, what's one advice you'd like to give to anybody who is probably starting this unfortunate journey of cancer? What would you like to tell them?
Have hope and find somebody that's been through this to kind of be there for you. We've all done it, and we all love providing hope. I remember just looking on, Facebook or whoever, they're just going through it now. Oh, look, she had it a year ago. Oh, look, she had it 2 years ago. And then, just having someone hold your hand and just being there for you while you're going through it. We're all in this together, and we're better together, and look for opportunity, learn something new. There's so many opportunities for us, even on YouTube, to learn to play the piano, learn to play the guitar, learn how to crochet, learn to knit. Find something that you enjoy doing and start doing it, and look for things like that. I'm trying to think. I love the adult coloring, painting. Doing something creative will really help you get through those days of fatigue, and just stay in touch with people. Yeah. Don't feel like you're, just because you have cancer, that nobody wants to talk to you. They do want to hear from you. They just don't know what to say. They haven't been through it, but they want to be there for you. And don't be afraid to reach out. And it's so great that we've done such this movement of video chatting, and because if I could have had this during my chemo, it would have been so fun. Right. To be able to just Zoom all my friends when I couldn't go anywhere, right? Absolutely. So, and then just to know you have a compassion for the people that are out there. Once we are able to go out and about in the public, as a cancer patient, you already know how to protect yourself from germs. They teach us this, right? Yeah. So just, smile with your eyes. We're probably going to be wearing masks, which we've all worn masks. Thank goodness, right? Everyone's like, hey, masks. Well, we worn them. Yep. We couldn't go out without them, right? So, give someone a smile, or, I do my, hey, I like your mask, wink, things like that. And of course, I haven't been anywhere I've only been outside hiking, and that's it. I haven't been in a grocery store. I haven't been in a retail. I can't even imagine what it will be like, but I'll know, I like that mask. I think I got one that says good vibes only on it, to wear. So yeah. And take risks. Risks are joy. You'll find joy in risks. Don't be afraid.
Absolutely. Well, thank you so much, Lauri, for spending your hour with us, and, sharing your beautiful story. And, let's just talk a little bit about what you're doing with your sleep center. That way, if anyone has issues, with sleep, which I know a lot of us do, and especially after going through chemo, there are days when I can't wake up, and then there are days where I just can't sleep. So how would you be able to help some of us?
So at Valley Sleep Center, we diagnose and treat sleep disorders, all sleep disorders. And our primary thing we see is obstructive sleep apnea, which is really common in men. But once women approach menopause, which a lot of us are thrown into that, we have the risk just as high as a male. I actually have severe sleep apnea. I think I probably had mild apnea when I was younger, but it's gotten worse after my breast cancer treatment, because the hormone replacement therapy that we do. No, that's not the word. Wrong. I can't take hormone replacement therapy. The aromatase inhibitors that blocks your hormones actually prevent the elasticity in your skin and your airway. It causes it to get really floppy. And so when we lay down to sleep at night, that airway obstructs, and you can get obstructive sleep apnea. It's usually represented with snoring, but some people will just gasp in their sleep. They'll feel really tired during the day. And the only reason I'm going over this is because people think sleep apnea is a disease that affects overweight people, and it's not true. So and if you've had breast cancer and you represent to your doctor fatigued and tired and sort of depressed, they're probably going to put you on antidepressants. So my message to you is go see get a sleep study. Go see one of our providers. Let's talk about what your symptoms are. Let's rule out any sleep disorder before we go down that antidepressant road, because sometimes it just your sleep. We also have sleep psychologists that will work with you for insomnia and any behavioral issues that you're having. Insomnia is very treatable, and all it is the inability to escape our thoughts. So it's very treatable, and we can help you without medication.
Yeah, and I think that's so important, and especially for cancer patients who've already got so much of chemo and stuff in our body. The last thing we want is some more medication. So
Right.
if you can fight it the natural way, why not? So that is great.
And the sleep apnea, we also, so if you're already been diagnosed with sleep apnea and you're on CPAP and you need supplies, Valley Sleep Therapy is our company for that. And we take all insurance. It's all covered by insurance, but we have cash pay options as well. And right now, you can see a provider from your home, get a home sleep test that's disposable. We mail it to you, and see a provider in a virtual follow-up. You never have to leave your home.
That's amazing.
Mm-hmm.
Yeah. I think right now, with what's going on and the fear that everyone's going through, I'm sure there's a lot of people who are having sleepless nights. So, this would be.
And now is the time to take care of your sleep, because if you're not sleeping, your immune system isn't going to be functioning optimally, and your respiratory system is key when it comes to sleeping. And if it's interrupted, then we're not going to have an optimal respiratory system either, which is really what we need right now to fight this virus.
Oh, yes, absolutely.
Yeah.
Well, I will be tagging your business on the Facebook.
Thank you.
So, if any of you need help with sleep, please do reach out to Lauri. She is amazing. I've been to her clinic and it is amazing. And they're all there to help you. Please do reach out. Well, thank you so much, Lauri, for your time.
Thank you.
And I hope to see you soon.
See you soon, Priya.